Sacroiliac joint intervention, hybrid technique. We have always done sacroiliac joint intervention by fluoroscope, by C-arm. But in recent times, this ultrasound guided sacroiliac joint injection has also become popular. So, can we consider the ultrasound machine or ultrasound image guidance as a complete replacement of fluoroscopy in SI joint injection? Or there is some advantage if we go for the hybrid technique. Let us. So what is the method of ultrasound guided SI joint injection? First, we will use the curvilinear probe, and if patient is say lying prone, and then we shall put the ultrasound probe in a transverse manner, in a short axis manner. We will search the PSIS. It is very easy to find the PSIS with ultrasound also, or even by palpation we can palpate the PSIS. So here in the first position number 1, we will see both the bones, ilium side and sacrum side. And here we will see the we will not see any foramen, sacral foramen here, because we are just below the S1 foramen. So here we will see the superficial bony structure of ilium. Then we shall gradually come down, say by 1 centimeter we will come down, and then we will see both the bones are coming at similar level, both ilium and sacral side. At that point we will be able to see both the joint, SI joint, and also the S2 foramen. At that point we will hold the probe, and our intervention injection needle will always be going from the opposite side. It is a like in X-ray also we are using the contralateral oblique technique. So here also the needle is coming from the opposite side only, and we will be able to see the joint very nicely with the ultrasound probe. So here intervention is being done under ultrasound, SI joint intervention. So this is position number 1. You can see the SI joint is much high up. Then I go down 1 centimeter below. I can see both the S2 foramen and SI joint. So our injection should come from the opposite side. The needle should come from the opposite side and enter in the SI joint. So now the local anesthetic is being given here, so to numb the path of the needle, which will be inserted later for SI joint intervention. So now we can see that this spinal needle, 22 gauge spinal needle is being inserted under the ultrasound guidance, and we can see that needle will come from the opposite side and it should go here. This is the joint line. So this is the SI joint and this part is S2 foramen. So you can see the needle is gradually coming and it is going to enter. So now it is entering in the joint. So this has entered in the joint. So finding the joint line under ultrasound is quite easy, and you will of course you will get a feel of loss of resistance there. So once the needle has been put by ultrasound, I planned to recheck it under fluoroscopy. So this is an AP view, and you can see that the needle has been put on the medial joint line, that is the posterior joint line. So needle is in the right place. So next step is to give some contrast and see if the distribution is correct or not. After giving contrast, I see this type of picture. So here you can see that contrast is distributed in throughout the joint line. So I am happy with that, the contrast distribution. But small amount of contrast is here also. So what can it be? So at this point, I am not going to comment on this, that this is abnormal or something. I will see again after 1 or 2. So after 1 second, when I take a second picture, second AP view picture, then I can see that contrast is no more there. And even this part of the contrast has become much lighter than the earlier projection. So I am very much confirmed now that this is nothing but a vascular distribution. So ultimately I had to reposition the needle and complete the procedure. So we can see that there is a clear advantage of the hybrid technique than only ultrasound guided SI joint intervention, because we cannot see the contrast distribution, and such a small amount of contrast, if it goes in the vascular inside a vessel, then we will not be, our procedure will not remain safe. So in that case, we must check by the fluoroscopy.